I'd like to welcome our first guest on the program today, actually new to ECFC, Donna Crisalli, the technical advisor at ECFC. Donna, good morning.
Hi. Sorry I was a little late calling in. I had some phone problems, but here I am.
Yeah, great to have you on here. Before we kind of jump in talking about, qualified medical expenses, et cetera, give our audience a little background on yourself and this new role that you're about to assume, as you are assuming at ECFC, please.
Oh, sure. I'd be happy to do that. Well, first of all, I was with the IRS for 20 years, a little over 20 years, and I retired at the end of last October. And so I am now working as an independent consultant to a number of companies, but recently I began working with ECFC, and I'm very, very happy to be here. I'm happy to contribute to their mission of education and compliance and provide expertise in the area of medical care. While I was at the IRS, during that entire 20 years, I worked in the area of what is a medical expense, and first as what we call a docket attorney. And I was one of the people who takes calls from the public, mostly from plan administrators, about whether something qualifies as a medical expense or doesn't qualify as a medical expense. I wrote a number of revenue rulings during that period of time, for example, on medical marijuana, on expenses to lose weight, smoking cessation, medical travel. And then I became a reviewer and continued to work on formal published guidance, including several more revenue rulings, and most importantly, a complete rewrite of the regulations, which have not been revised for 20 years or more, 25 probably. There are a number of statutory changes that have occurred during that period of time, and the regulations don't reflect them. They also reflect a lot of obsolete provisions. Unfortunately, those regulations have not been published yet. Hopefully they will be sometime soon. But what we tried to do there was not only update the regulations to conform to the statute, but deal with many, many of the questions that we received over the years. So now I will be bringing this background and this expertise to ECFC and helping their members to deal with the more complicated questions of whether an item qualifies as a medical expense or not. It can seem fairly simple, but it can also be very complicated, very dependent on the particular facts. So I will be available to respond directly to members' questions. I'll be serving as a member of the technical advisory group. I'll be perhaps making presentations at conferences, as I did recently, last week. And I may provide other resources in this area.
Well, that's great. It sounds like a good role there. And, as ECFC celebrates its 35th anniversary, Marty, the board, and all of you have a lot of really positive initiatives moving forward, and we appreciate the partnership with ECFC as well. Donna, talk a little bit about what constitutes a medical expense.
Well, I just recently spoke for an hour and 15 minutes on that at the conference. So I'm sure you don't want me to do that. Right. I will hit some of the high points. So there's a basic definition, and that is that it is an expense for medical care, and that means that the primary purpose has to be to treat, cure, diagnose, mitigate, or prevent disease or illness, which includes an injury or other dysfunctions of the body, or to affect a structure or function of the body. Interestingly, this is the definition of a drug in Food and Drug Law, although that applies to items and, articles and substances. So this is for any expense. And then there's some specific things that qualify as medical expenses: travel expenses related to medical care, long-term care services, and health insurance premiums, including Medicare. Then there are, and I could go into each of these, in great detail. Then there are limitations. So it can't be a cosmetic procedure. That is one that is it improves appearance and does not meaningfully affect a function of the body unless there's a deformity, and then it can be solely to correct appearance. It cannot be illegal under any law. So you probably saw the recent pronouncement by the government that they're going to keep marijuana on as a Schedule I drug, which means medical marijuana is going to continue to not be reimbursable. There are limitations on expenses for travel, and then there is the infamous prescription requirement for drugs, whatever is a drug or medication. And, of course, for reimbursement purposes, it's not whether or not it requires a prescription, but whether or not the participant has a prescription. So I just want to mention a couple things that are not required because this is kind of there are a lot of misperceptions in this area. In general, you don't need a doctor's prescription. It doesn't have to be provided by a medical expert or practitioner. There's no requirement that it be medically necessary, that it be medically effective, or that it be the least effective alternative. These are all concepts that come from insurance companies, FDA law, et cetera, and so forth. They are not requirements for medical expenses, at least not as a general matter. Of course, I just mentioned that you need a prescription for a drug. But these factors do become relevant when you get into, and I'm almost done, don't worry, I'm not going to go into, an encyclopedia here. They do become relevant when you get into expenses that might be personal and might be medical. And this is where a lot of the meat is. This is where a lot of the difficulty comes in. So you have mixed-use items like a car that's specially adapted for handicap use, or expenses to lose weight. If you're suffering from obesity, they might qualify. If you're exercising in relation to a medical condition, it might qualify. If you're exercising just to maintain your general good health, it doesn't qualify. So the primary purpose has to be for medical care as I defined, and that there are a number of facts and circumstances that have to be considered. The ones I just said are not generally required, are relevant for this purpose. Do you have a disease? Has a doctor said this will be helpful for you? And then you also have to satisfy what has been called the but-for test, which means you would not be doing this but for the disease or illness. So just to give you a quick example, if you play golf and your doctor says, well, mild exercise will be good to mitigate your emphysema, you cannot then start writing off your golf expenses or getting reimbursed for them because you would be playing golf anyway. If you can establish that you took up golf solely for this purpose, then you might have a reimbursable expense. So those are the highlights.
But I think you touched on this a little bit, but we've got new trends in healthcare delivery coming around: telemedicine, alternative medicine, concierge medicine. Where does that fit into the definition of medical expenses?
Well, that's an interesting topic, and one that we would get a lot of questions about at the IRS. The fact that there's a new way of doing business or new technology doesn't really change the analysis. You still have to look to what is the purpose of whatever you're paying for. Is it medical or is it personal? Does it meet the definition of medical expenses? So let me give you some examples. Telemedicine, big thing these days. if what's being provided through telemedicine is medical services, as I defined, they treat, cure, diagnose, prevent, or mitigate illness or injury, then they qualify. The fact that it's being provided via a computer doesn't really affect that. Alternative medicine, that's another area. There's some interesting authorities out there. One of my favorites is a case involving a shaman, an Indian medicine man, who was paid to do a thing to cure cancer. And this was not a question we got when I was at the IRS. This is a case that was before the tax court, and the court said that qualifies as a medical expense because the purpose of it was to treat cancer. So the fact that it's alternative, it's unusual, it may or may not be effective, is not material. So alternative treatments like acupuncture or Reiki that may or may not be effective. I think acupuncture is fairly well established, but some other treatments that maybe may or may not be, if the purpose is to do one of those things and it does not have a personal use, then it's going to qualify. Where you have a problem with some of these new practices or models is where some of what they're providing is medical and some is personal, or maybe the principal reason is not medical. So a good example for that is concierge medical practices. We started getting questions about this at the IRS years ago, and the response always was no, it doesn't qualify, based on our understanding of it. If the now this is what I understand it means. A doctor charges his patients or her patients a flat fee every year, not specifically for medical services, but to enable the doctor to reduce the number of patients and provide more personal service to the patients that he retains. So you don't have to wait as long for an appointment. You don't have to wait in the office. When you get there, you get the doctor's phone number. You can call the doctor at any time of the day or night, and you're paying a fee for this. Our position was always, and I'm sure it continues, I don't think it's changed in the last 8 or 9 months, that does not qualify as medical care because the purpose is not to treat, diagnose, prevent an illness. There are no medical services being provided. You're paying for the convenience of having greater access to the doctor. Now, you might look at that as an indirect expense that maybe should qualify, but when an indirect expense qualifies as medical care, it's because it's essential that you pay it. So, for example, if you buy something, bandages or a wheelchair, whatever, and there's sales taxes. Those sales taxes also qualify because you have to pay them. If you have an in-home nurse and you have to pay employment taxes, that qualifies because you have to pay them. But you don't have to pay a concierge fee. So as I said, it's the same analysis no matter what the new method of the new kinds of services or the new method of delivering them. What you have to look at is what is being provided.
Okay. Let me ask you this: just you've been at the IRS, and while you were there, what's some of the strangest requests you've ever gotten around this topic? I don't know that we got that many strange requests when I was there. There are some strange items out there. One item that we got a request about was for cayenne pepper. Why would somebody want cayenne pepper for medical care? I think that it could be a
a treatment for Raynaud's disease. I also understand that it is sometimes recommended for burning mouth syndrome. So if you have burning mouth, you take cayenne pepper and it burns even more, and somehow that mitigates it. So that was one, and that would qualify if you're using it for medical care. Mm-hmm. At the one of the things that I was asked at the ECFC conferences is about an Apple Watch. Suppose the Apple Watch has a feature that measures your blood pressure. Would it qualify? And my answer to that is no, because that's a pretty minor part of the Apple Watch, and it's highly unlikely that you are buying that Apple Watch as a blood pressure monitor. So that would not qualify. Among the some of the cases that are out there, one of my favorites is the Indian medicine man. I mean, that is my favorite. That is certainly unusual. The but-for test comes from another interesting case that involves legal fees. A man was getting a divorce, and he tried to write off his legal fees on the basis that it helped his mental health. And the court said, no, you would have gotten a divorce anyway. You are not in court incurring these legal fees but for the divorce. So they said no to that. And a recent one in the last couple of years that's come up a lot at ECFC conferences is mosquito repellent. That has supplanted sunscreen as one of the number one questions. Sunscreen, I advised them that I thought sunscreen qualified. See, one of the problems is when you're talking about what prevents the disease or illness, it's very hard to distinguish between something that just promotes your general good health and preventing a disease. And if the possibility of getting a disease is very remote, it's questionable as to whether you can say that something is for medical care. Sunscreen, I thought, was okay because if you don't use it, you're going to burn.
Right.
Mosquito repellent is very difficult. It's very hard to say no when, first it was West Nile virus and now it's Zika. You have very serious illnesses out there. On the other hand, there is probably very, very small risk that if you don't use it, you're going to get sick. So that is a question that's still up in the air, and I hope that the regulations will come out and answer it.
Well, Donna, listen, it's been great having you on the program today. We're at the end of this segment, and I wish you well at ECFC. Can you leave our audience with a way they can connect with you and contact you if they have questions?
I have an email of Donna at Donna M. Crisalli, CRISALLI.com. Now, I have another email, dcrisalli at ecfu.org, but I would ask that only ECFC members use it.
Right. Understand. Well, Donna, listen, we've appreciated having you on the program today. You have a great weekend, and we'll talk to you again soon.
Well, thanks for having me.
Thanks, Donna.